Hi everyone, welcome to our data science project. Our group was interested in looking at the health of incarcerated individuals in the United States. We did this by looking at a data set that comes from a survey that's conducted every couple of years at state and federal correctional facilities. This survey is from 2003 and 2004. We started by cleaning up our data set and performing some exploratory analysis on the demographics of the population, including educational attainment and income. We then looked at some of the incarceration-related variables, stratified those by mental health history. We then looked at mental health specifically, as well as HIV status in the incarcerated population. Initially, we were interested in studying HIV in a little bit more depth, but we realized that there's only a very small proportion of the prison population that's HIV positive. So we decided to focus our project more on mental health characteristics. We performed some statistical analyses to understand the strength of various observed associations. We found that both mental health and HIV status, as well as mental health and arrest history, are significant associations, and we performed some regression analyses to understand these relationships a little bit deeper. We finally performed some model selection to understand what other potential covariates can be used as predictors of an inmate's mental health status. We found that number of prior arrests, race, sex, HIV history, and abuse history were the strongest predictors. Finally, we created some maps to create a geographic visualization of these hotspots of HIV status, mental health history, and mental health as it relates to their arrest. Finally, you can see all the details of our methodology and the steps that we took to produce these outcomes in the project report tab. You can also see our coding details in our GitHub repository. Thanks so much for listening.